go.
Okay, so we're going to prepare our patient for the composite procedure. So we'll give them a little bit of chapstick or Vaseline here. And we are working on tooth number 5. And we're going to do an infiltration. So I'm just going to place some topical here. And remember, the topical is going to get the gums numb at the injection site. So typically this will sit about a minute to 5 minutes, depending on the type of topical anesthetic. With some of the newer ones, they work really quickly. So just check your manufacturer's instructions. So we'll remove that. And then I'm going to pass the anesthetic syringe to my operator. So making sure that loosened that. And then the injection is given to the patient, and then we'll let that soak in for a little bit until they're numb. Once that injection has been administered, we'll rinse the patient out because the anesthetic doesn't taste good sometimes. So make sure that you give them a nice little rinse. And the next step will be to place isolation. So we're assuming here that our patient is numb and we're ready to start the procedure. So we're going to place the IsoLite or dry shield in. Remember to place it on the opposite side of where we're working. And our patient can rest on that. And then we would turn that on and it would be suctioning up all of the flavors. So the next step, we're going to prepare the tooth. So this is when the dentist will take the high-speed handpiece and prepare the tooth by removing all of the decay. As the assistant, your responsibility will be to suction and keep the area dry. Since we're using IsoLite, it will suction for us, but if we weren't using that, we would introduce our HVE. So that 330 burr is removing all of the decay, opening up that tooth, making sure that we get it nice and clean and everything removed before we place the filling. So if there's a little bit of water on their mirror, you can dry that off. Make sure your doctor has a nice dry field. Always watching what they're doing and remaining one step ahead. So that looks pretty good. So since there was a break, I'll give that a little rinse so they have a nice dry field. Next, we'll use the slow speed with the ball, or excuse me, the round burr that looks like a ball shape, and it slowly goes in and removes all of the decay. As the assistant, I'm watching to make sure the field is dry, the mirror, it's nice and clear, and I'm also looking at my patient, making sure they're doing okay. So then we'll rinse that out, get all of the water and saliva out of there. And now that the tooth has been prepared, we're ready to fill. If we were doing a filling that was going in between the teeth, we would at this point place our matrix band. But because this is a class 1, where we are not building up a wall, we will go straight to the etch step next. So remember, the etch is going to condition the tooth and get it ready for the adhesive. It's applied to the tooth where the filling will go, and it's very important to make sure that it doesn't get on the tissue because it can burn the tissue. That sits for about 20 seconds, and then we will rinse that all off. making sure it's nice and dry. And then we will use our bond next, and this helps the filling stick to the tooth. So I'll apply a little bit on my brush, pass it to the operator, and we're going to get the light ready because this step is light cured. While that adhesive is going in, the operator is scrubbing it into place, making sure to get into all of the nooks and crannies, and then a light air dry comes next to make sure the bond is evenly distributed across the tooth. Is then light cured. So just like with all of our other stuff, you always want to check the manufacturer's instructions. Typically adhesive can be 10 seconds and composite is 20 depending on the style of light. Now that we've etched and we placed our bond, we will next do a flowable composite in the bottom of the prep. Remember, the flowable is more viscous, so it gets down into the depth of the tooth, whereas the packable is a lot thicker. So packable is going in next, and then I'm going to pass the operator the condenser to pack it down into place. So the packable is going in now. We'll pass our condensing instrument. The condensing instrument pushes it down in there. And depending on the preference of the operator, a ball or acorn or some anatomy style instrument would be passed next to create anatomy in the tooth to make it look like it has natural cusps and grooves. As the assistant, you're going to be holding out gauze and cleaning up any extra material off of the instruments. So once we've put an anatomy in here and gotten the filling, the shape we would like it to be, we will then light cure it so that it sets up. For the composite material, the curing process is approximately 20 seconds, but again, depending on the light. Some preps that may be deeper than this one may require multiple layers of composite. So if it's a very deep filling, you may be curing multiple times in between filling the tooth. So we'll go ahead and light cure that for 20 seconds until it's completely set up. And then the last step will be to polish it and make sure the bite is correct. So we'll say that 20 seconds has elapsed. Meanwhile, while that's being cured, the operator is changing the burrs in the handpiece to a finishing burr. So this will give us a nice polish. And assistant will have suction in hand ready to go and air water while that's being polished and smoothed down. So the burr that's being used is a football style burr, and it's designed to help put that nice polish onto the occlusal surface. And there are many different styles of burrs, and they vary based on the style the dentist likes. But football is pretty common burr, in addition to a flame style burr that we use a lot of times when we're building a filling that goes interproximally. So checking, making sure the field is dry, the mirror is nice and clean, and that looks good. I'll rinse that off a bit, and then we'll check our bite. So we polish the filling. In order to check the bite, we'll have to remove our isolation device. So we'll gently take that out. Remember, we would have this on. It would suck up all the ropey saliva. And then we'll use our bite paper to check the bite. So you always want to pass this the way it's going to be held in the mouth. And the patient will bite down, tap, tap, tap. You may have them grind side to side, and this will mark where the tooth is high. So if there are blue spots on the tooth, we'll know where to adjust it. In this case, looks pretty good. So no adjustments are needed, but if there were, we would just go back with those fine polishing burrs and get it nice and smooth and check the bite. And we would also floss interproximal if we were doing a filling that went in between the teeth.